This is a medical grade bone set used by the medicos to understand and study the features of the bone. To start with the skull can be understood in the following ways. This is norma frontalis, norma lateralis, norma verticalis, norma occipitalis, and norma basalis. Below the skull present a small bone called the hyoid bone in the anterior neck region, and this bone does not articulate with any other bone, but it is placed in its position with the help of the muscle attached to it. The posterior aspect of the neck is formed by the cervical bones. They are 7, and the first cervical bone is called as atlas and the second one is called as axis. The atlas articulates with the occipital condyles forming the atlanto-occipital joint. The second bone is identified with the odontoid process or dens, and this articulates with the first bone forming the atlanto-axial joint. On the superior aspect of the thorax on the anterior part has a bone called the clavicle. This is the only horizontal bone in our body, and this bone gives the shape to the thorax. On the posterior aspect, on posterior, lateral and superiorly on the thoracic cage present the scapula, and this scapula on its lateral side has a cavity called the glenoid cavity. The glenoid cavity articulates with the head of the humerus. This humerus is the bone of the arm. This head of the humerus articulates with the glenoid cavity forming the shoulder joint. The lower end of the humerus is articulated with two forearm bones called the ulna and radius, and these bones form the elbow joint. And the lower end of radius and ulna articulate with the carpal bones forming the wrist joint. The carpal bones are scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate and hamate. These are the metacarpal bones, and the rest are phalanges forming the proper hand. The thoracic cage is made up of 12 pairs of ribs, and anteriorly they articulate with the sternum via the costal cartilages, and on the posterior side they articulate with the respective vertebrae. On the posterior aspect of the thorax are formed by the 12 thoracic vertebrae, and these thoracic vertebrae are identified from the wrist by the presence of the articular facets on the transverse process for the ribs. Down the 12 thoracic vertebrae present the 5 lumbar vertebrae. These lumbar vertebrae are identified from the wrist with the bigger body, and they do not have any articular facets or the foramens. Below the lumbar vertebra presents a sacrum which is of a different shape,